High impact medicine is about more doctors doing more good in the world with their work, their careers, and with their giving, the philanthropic money donations. More than that, it is encouraging and enabling physicians to realize that the impact that they really add to the world can be multiplied significantly beyond what they might achieve through, I'm going to say, a standard medical career, bedside or clinic-based medicine. So in a nutshell, that's what it is. And when we look at the numbers, it is very effective at doing that. So for every dollar that the organization receives, the impact of that dollar is multiplied by about 10 times the value comes from it in terms of career changes and their impact, and in terms of philanthropic giving that is brought about through the work of high impact medicine. So that's the organization that I'm joining. And it is really about finding those physicians, medical students at the beginning of their medical journey, and physicians at any stage of their career, and helping them to see the kind of impact that they can have by either changing their career, or perhaps more importantly, by adding a component to their career, so that not necessarily giving up clinical medicine, but using some time in their career to do highly impactful work. And that is one possibility. And then there's another possibility. If they're getting a salary from which they can afford to give a small proportion, they choose to do that to highly impactful charities to support their work throughout their careers. And that, of course, multiplies up to a lot of giving, a lot of dollars over time. And those dollars can save lives in a highly cost-effective way when given to these specific organizations. Hello, my name is Simon Ling. I am an academic pediatric gastroenterologist, and I am the new executive director of High Impact Medicine.
Career journey. Walk us through your career path. What were the key moments that shaped where you are today?
So my career, I was born and raised in a place called Bromley, which is a suburb of London in the United Kingdom. After high school, I had the opportunity to take a gap year, and I chose then to join up with an organization called Project Trust, which placed people like me into mostly teaching jobs in various countries in the world. And I went to Kenya and taught in a small village school in the coast province of Kenya for a year, which of course was a very formative experience for me. And then from that, I came out from there and went to medical school at the University of Edinburgh in Scotland, where I had a great time. At the beginning of my fifth year, I hit my pediatrics rotation, and it was literally like someone had turned the switch on. And I suddenly got what medicine could be for me, what it was all about. From that day forward, I've been a committed pediatrician, and my career in pediatrics became clear to me from then. So I went into training in pediatrics, mostly focused around the south of Scotland. But I had this ongoing interest in global health following the exposure that I'd had to life in Kenya. That took me to my first experience of academic research in pediatrics. A group of us were able to collaborate with a professor of public health in Mumbai, and Professor Gopal Kothari took on this project with six of us to undertake a nutrition screening survey in the urban slum area of Dharavi in Mumbai. And I spent 3 months one summer with these colleagues undertaking this survey, and learned a lot about life in that kind of context, and about how to conduct academic research, about the challenges of field work and trying to get data from those sorts of situations. And that led to our first little publication reporting those results. The global health continued to be an interest for me. I was able to spend some months working in a hospital in Tanzania, in another hospital in Botswana. And then as my pediatric training went on, I decided to try to commit some more time to the research side of things, and working with a professor at University of Edinburgh called William Cutting, and collaborating with researchers in Dhaka in Bangladesh. We set up and got started with a randomized controlled trial of zinc supplementation in the management of severe acute malnutrition. And we worked on that study for a year, setting it up, getting it going, handed it off to another colleague who took it forward over the subsequent year after I'd returned to Edinburgh. And again, that led to nice publication in the American Journal of Clinical Nutrition. A great learning experience about how to set up research in that context. We ended up, first of all, going into pediatric gastroenterology, and secondly, pursuing some additional training here at the Hospital for Sick Children in Toronto, which really opened my eyes to a different way of thinking and working about academic pediatrics. After going back to a consultant position at the Children's Hospital in Glasgow, after a couple of years, I was recruited back to Sick Kids here in Toronto, and that's where I've spent my last 22 years now, working on staff and as an academic clinician here at Sick Kids. During that time, my focus has been on children with gastrointestinal and particularly liver disease. The global health maybe slipped a little into the background, although maintained an interest in that. But in terms of the practical work I was doing, it became more focused on the types of issues I was dealing with, particularly children with portal hypertension, children with cystic fibrosis liver disease, but also importantly, children with viral hepatitis, chronic viral hepatitis B and hepatitis C. So the academic focus moved on to these different areas, but I enrolled Sick Kids into a multi-center collaborative research effort called the Hepatitis B Research Network that was funded from the NIH in the US. And that maintained and grew my interest in hepatitis B. Over the years, I then had an opportunity to collaborate with the Viral Hepatitis Working Group at the World Health Organization in putting together their new 2024 clinical practice guideline for hepatitis B, which again was a great experience collaborating with interested experts from around the world, both from adult medicine and from pediatric medicine, including academic research hepatologists from the global south, bringing their voice to the table. Critically important because of the hotspots of hepatitis B in particular, sub-Saharan Africa, increasingly. So it was another great learning experience about how you can take your academic experience and convert it into significant impact for the world in creating a guideline that is of so much help and importance in all countries in the world, especially in terms of the WHO guideline in the global south.
What inspired you to join high impact medicine?
So that brings me to the more recent years. During my time at Sick Kids, I had undertaken some leadership positions, first as the training program director for a training program in pediatric gastroenterology that attracts great trainees from around the world. Really important position and really interesting and inspiring position in terms of the individuals that we get to work with and train, and hopefully to help craft their careers and their futures along with them. And then from that, I became the division head for the gastroenterology, hepatology, and nutrition division at Sick Kids, and served in that position from 2015, so 5 years before. And then, of course, when the COVID epidemic hit in 2020, had to help take the division through the impact of the of COVID, which was a major effort for the hospital and for leaders in the hospital of all kinds. And as we came out of that, I was really burnt out. I think the workload had increased significantly in many respects. And around that time, I realized I needed to make a change in my career. I needed to step back a bit from those leadership elements of my job. And in doing so, entered a period of reflection where I increasingly realized that the type of job I'd been doing needed to change. The interest and desire to do more in global health and to have more impact around the world, I felt quite strongly within me. And That is when I started to research into what different kinds of roles I might be able to play in the next 5, 10 years maybe of my career to boost that impact whilst doing something different to what I'd done previously. And through that research, I came across the 80,000 hours, the effective altruism movement and community. I hit upon the high impact professionals organization. I undertook their Impact Accelerator program, which was a fantastic program that really helped me focus in on what I needed to do and where I might be able to end up. I did some volunteering after that with the Clear Solutions group, who are working to improve the implementation of use of oral rehydration solution and zinc supplementation for children with acute diarrhea, where there are many lives that can be saved in a very cost-effective way. And that really reinforced my desire to continue work in this kind of area. And then as my decision to leave Sick Kids and the deadline for that started to come forward, I started to actively look for positions. And that's when this role at High Impact Medicine was advertised and I applied. And here we are today. So that brings us up to date with my career journey.
What has been the main focus of your career over time? How do you decide when to say yes to new opportunities?
I think there is a thread that sort of ties this together in terms of a couple of things. One is a dedication to child health became clear to me back at that early stage in my medical school experience as soon as I came to pediatrics, and it's remained firm and core to everything since then. Beyond that, pediatric gastroenterology and hepatology nutrition, that has continued to be a real sort of core theme in my career. In the context of an academic medical career, it's not unusual to have these sort of different opportunities laid out in front of you that arise from activities in clinical care, from the need and desire to do research, the fact that if you work in an academic center, trainees are all around you and they need to be trained. So you're involved in training and education. I can tell you, when I started my consultant position in Glasgow in Scotland, a piece of advice I got was this: say no to everything for at least 3 years, and then you know where you stand and you can start to figure out what you want to say yes to. Okay, that's one piece of advice. When I started here in Toronto, the advice I was given by the department chair at the time was say yes to everything, because you never know where those opportunities might lead. So diametrically opposite advice. And I think that illustrates challenge that we all face with our careers, which is the balance between focus and the importance of focusing down on a specific thing. And you will often hear that advice: stay focused. Focus, focus, focus is the way to success in your career. And balancing that against the different types of opportunities that come to you, some of which may lead to amazingly interesting things for you in the future. My own example of that is the hepatitis B thing. I had not seen hepatitis B as a real interest of mine up until a year or two after I started here at Sick Kids. Then this opportunity to take our center into the hepatitis B research network came up, because one of the adult hepatologists from Toronto wanted to join the network when it was being set up. And the idea was to try to attract combined adult and pediatric programs into this combined adult and pediatric research effort. So this was Jenny Heathcote, came to me and said, Simon, how do you feel about joining this hepatitis B research network? We'd love to go in on the adult side. It'd be great if you could join us on the pediatric side. And that was the first time that I'd really thought about hepatitis B. And with this advice echoing in my ears, say yes to everything, this did feel like quite a significant opportunity. And so I said yes. And there began what has ended up as a major component of my career, big academic interest for me, and something that I've got immense reward from. In summary, we all are challenged by the variety of opportunities that open up in front of us. Focus is good, but so also is the need to recognize opportunities when they come and to take them, even with some uncertainty about where they're going to lead. And finding that balance is, I think, the challenge for all of us.
What has been your inner compass? when navigating the different pivots in your career?
I think I've always had in me recognition that two things. One is the world has some big problems, and those really matter to me. Secondly, in some way, I can have a role in addressing those problems. Of course, that in my mind is always limited. I don't see myself as some hero that's going to solve these problems, but I feel in me that I have a role in helping to address those problems. That's the background. That's the sort of foundation. Then, as I mentioned, I hit a point over the last few years where I realized the kind of work I was doing was not sustainable for me. And I needed to step back from that. And at that time, really this desire to do something different in addressing those world problems surfaced as a key thing. I recognized that I'd had so much impact during my career, not great, but something. And I wanted to make sure that I used the next few years to try to do more. And my fear was that by staying in the position that I was in, that actually my ability to have impact would sort of start to dwindle.
What advice would you give to young doctors who are just starting out?
The young doctors that I've had the real pleasure to work with over all the years of my career are typically highly motivated, very smart, and often very ambitious. And that ambition can, of course, manifest in different ways. But is typically dedicated towards being a good physician, towards having an academic component to their jobs because of the nature of the place where I have worked, and to being successful in that respect. And the success, I think, is variously defined by them. But I think what they see themselves doing is taking care of patients well and producing good clinical research that is important in the world. And through that, building a reputation as someone who's contributing in their subspecialist area. That's where I think most of the trainees that I have dealt with are sort of starting out. The advice that I have tried to give them is based around guidance in terms of how to achieve those sort of outcomes, depending on the background where they come from. I think fundamentally the important thing that I stress is to aim for excellence. Don't settle. Aim for excellence. That's number one. When you do that, you put yourself in strong positions when opportunities come up from which you can benefit yourself or from which you can build your impact in the world. If you're seen as someone who's striving for the best, then those opportunities come to you and you can springboard from one to the next. So I think aiming for excellence, saying yes to opportunities when they come up, leveraging your network, build relationships, find the people that can help you achieve success. And those people may be in various different places. You may not be working in a center where there's several, in my context, pediatric gastroenterologists all together. You may be on your own. And then you have to find that network, and you can find it through practitioners in other specialties, through scientists working in other areas, through people in other towns or other countries in your region. You can build and find those opportunities. There are a number of ways that one can try to break into a clinical research career, for example, even if you're not working in a well-established academic center. So there's different ways of doing that we can advise people about as well. And then I think is also to recognize the breadth of opportunities that go beyond the clinical research thing that I think most people often focus on when they think about trying to have more impact. Teaching, education can be very powerful in multiplying your impact. Getting involved in policy work, very impactful. Helping with patient support groups, multiple different areas where you can build your impact and your success in a career and the rewards you're getting from that.
Were there any moments in your career when you thought, yes, this is exactly why I'm doing this?
I think that there are a number of occasions in my career where I've been fortunate enough to feel like really in the moment, this is why I'm here and this is what I'm doing. And I suppose they fall into two areas. One is specific patient-related contacts where you feel that you have really helped a patient or family to understand what's going on with their sick child and to understand that there's a future for them. I've dealt through my career with pediatric liver disease, and for some of those children, it is severe, life-threatening, and sometimes of acute onset in an otherwise apparently well child. Those families come feeling that their child is about to die, and to take them from that fear to an understanding of what's going on, to an understanding of what the opportunities for treatment are, and fortunately for many of them, for most of them, that there is a future ahead. Taking those families through that process, many examples I've been fortunate to have in my career where you really feel that that is having big impact for that family. So that's one kind of really important experience that one can have as a practicing physician. On the academic side, I think each time that a piece of academic work reaches completion, and typically that involves some kind of publication, whether it's a research study or a clinical practice guideline. That is a big moment. For me, the publication of the WHO hepatitis B guideline most recently last year was a time when I really felt that this is something I want to be doing with my time and my energy and my career. Recognizing that I'd had the opportunity to work with great experts to bring my perspective on how to manage children with hepatitis B, to work alongside experts from countries where they see different prevalence and different manifestations of hepatitis B and face different problems in its diagnosis, management, and prevention. Putting that all together, working on that through about 18 months probably was the process, and coming out with a great product at the end of it that you know is going to make a big difference for practitioners around the world. That's a moment that is really important. And I think if you're doing clinical research and you're not getting that sense with the output of the research, then you need to think carefully about what it is that you're focusing on.
In your view, what separates truly impactful clinical research from the rest?
This relates to clinical research in medicine. And I think what I have come to realize, and what I would really like all doctors to understand early in their careers, is that clinical research comes in different shapes and sizes, and some of it is very impactful, but a lot of it is not. And just by giving part of your career to clinical research does not mean you are necessarily being impactful. So what do I mean by that? I've sat around a research consortium table on a few occasions where someone has said something like, how can we get another publication out of this data set? And that statement demonstrates a real problem with the way that the academic medical research world is sometimes thinking, not always and not all people. But the desire to get publications, to build CVs, to add to one's profile as an academic researcher is understandable, but it leads to a lot of publications that are not impactful in the world and a lot of research work that is therefore not necessarily using research dollars to the best means. I was in a talk just last week, actually, by a researcher who was quoting a leader from a research funding organization in North America who said, you do realize that most academic medical research has no benefit at any time for anyone in any place. And that is a realization that I've come to, which I did not have at the beginning of my career. Be careful with what research you're engaging in when you're in the earlier stages of your career. If you really want to have impact in your career, choose carefully who you're going to be mentored by, where you're going to start out that research career, and make sure it is a team or a lab that is doing work that is likely to be impactful.
What does effective leadership in global health look like to you?
A lot has been written about leadership and the skills that are needed. And of course, there are many different qualities and skills. There are three things I think that I would want to highlight. One is for the importance of humility and the power that that can bring to a leader in increasing their awareness and their engagement with the people and the organizations that they're leading. So empathy, I think, is important. Generosity, I think, is an important quality. Generosity of time and empathy and effort to help the people that you're leading achieve what they are trying to achieve so that the organization moves forward in the right direction. But those are two qualities that I think I prize in leaders and that I try to bring to my own leadership. The third thing I would say is related to the global health aspect of this. And I think a current challenge in global health and for leaders in global health is to recognize the important role of moving leadership to where it should be in the global south and enabling that voice to be at the center of what's happening in global health and to be truly leading the effort to achieve better health around the world. There is a history of global health arising from the colonial times that plays out even now in terms of where and who the leading centers are. And leaders working in global health areas who are from the global north need to be ensuring that they are acting as allies to lift and focus at the center of what's happening, those leadership voices from the global south.
How do you approach work-life balance?
I am lucky to be married for many years with my wife, Julie, and I have 3 adult children now. And family is really important to me. It's center of my world, and we have a lot of fun together. I'm lucky that they all live here in the same city with me, although they've moved out from our house. I have 2 dogs that keep us busy walking and enjoying them. And what do we like to do? We like to leave the city, head north to an area of lakes and forests and camp there with our dogs and paddle canoes in true Canadian style. So that's one of the key things I do to have fun, to relax, refocus, re-energize, and to get a bit of thinking time as well. I've also, in recent years, come back to something I did a little bit of when I was younger, which is painting and drawing. And I'm trying to conscientiously every week spend a couple of hours creating a watercolor painting or a charcoal drawing. And that is fantastic. I can feel the other half of my brain lighting up when I do that, and it gives me a lot of fun and reward.
What strategies help you stay grounded and focused during high-pressure situations?
So when things get really busy, really overwhelming, there are 3 things that I think of. Number 1 is take a step back, look at what's in front of you, what you need to achieve, prioritize, and approach this overwhelming work along the lines of a prioritized list. 2 is there are always people out there that will help you, and make sure that you reach out, use the people around you, your network, leverage their support. There's always people that will help. And then thirdly, remember why you're doing what you're doing. Think about the problems, the big problems in the world, what you're trying to achieve, and the impact that you can have. That combination will get you through those difficult times until things settle again.